Hello everyone. I am Dr. Anil Kamath. I'm a consultant surgical oncologist here at Healius Cancer Clinic. So I would like to take this opportunity to tell you all about palliative care. What exactly is palliative care? Now we as oncologists very often we are involved with the treatment of cancer patients. But it so happens that certain patients after treatment will have recurrence or relapse, and it goes to a stage where treatment is no longer meaningful. Say there is a patient with oral cancer. We would first offer surgery, then offer chemotherapy, radiation. Now, not all patients that one treats gets cured. A certain proportion of patients get cured and a certain proportion have relapse. These relapsed patients most of the time don't do as well as those who receive upfront treatment. And treatment options keep diminishing and the results also keep coming down. So there are patients with multiple relapses whom we cannot offer any meaningful treatment. So what happens to these patients? Now, it is important that though we cannot treat the patient, we offer them a meaningful quality of life. So, our treatment is directed not at the disease but at relieving the symptoms of the patient. And this is what is called palliative care. So, in palliative care, we don't aim at treating the disease. So, we don't treat the oral cancer. But if patient has pain because of oral cancer, we see how we can control the pain. Palliative care is a very important part of cancer. This is because quite a few cancer patients do have recurrence and this causes a lot of anxiety among the patients. These patients will be crying from pain, they'll not be able to sleep, they'll not be able to eat properly. So someone has to take care of them. Though there is no further treatment options available, someone has to still take care of them, and this is the job of palliative care. Many times there is an unmet need that doctors too don't emphasize enough or do not prefer to treat these patients because they feel that it's a dead end and there is no hope. But we definitely can look at one, relief of symptoms and prolonging their survival as much as possible with a better quality of life. So this is what is the concept of palliative care. Now, who offers this palliative care? For palliative care, usually there are separate specialists who are specialists in palliative care itself. But unfortunately, in India at least, these specialists are not easily available. And the centers which offer palliative care are also very few. Very often, the patient, since they have been regularly taking treatment under a surgical oncologist or a medical oncologist, end up going to them. And as a part of palliative care, at least up to a certain degree, we can offer them some palliative treatment. What can the symptoms be? The symptoms can be very varied depending on the type of cancer. But the most common symptom that we come across is pain. Cancer patients can have very severe pain, and pain makes the patient psychologically very aggressive sometimes. It hampers their sleep, it hampers their relationships with the other patients. They feel others are not able to understand them or give them enough relief. And it is very important that adequate pain relief is given. I'll have one separate video on how to offer pain relief for these patients. Other symptoms, say in a lung cancer patient or a patient who has pulmonary metastasis, can be breathlessness. The patient cannot walk for even few steps because he becomes breathless. They will have trouble lying down. Other symptoms can be difficulty in eating, lack of appetite. So each symptom has to be discussed with the patient and appropriate treatment has to be offered. Very often we may have to interact with the people from other departments. Say if a patient is not able to eat orally, a feeding tube might have to be placed. This might be the job of some other specialty. So coordination with some other specialties may be required to relieve these symptoms. Now, apart from this, one is the physical well-being of the patient. Other is the mental well-being. We also have to see that these patients do not go into depression, that we have to offer them some sort of antidepressant, some sort of counseling, and not just the patient. The disease of the patient affects the relatives also. So a family counseling regarding handling of these patients is also required. Palliative care is a very vast specialty and it's an underdeveloped specialty. But even if your near and dear ones who are suffering from cancer cannot be offered treatment, they certainly can be offered treatment which will give them some relief and some better quality of life. Thank you.